Hello, and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on arbovirus infections. The epidemiology of arbovirus is that it is a zoonosis and it's transmitted in most parts of the world. It's an arthropod-borne infection, and it can sometimes cause very localized distribution of infection. It can result in sudden outbreaks if range of animal host changes, and it's transmitted by ticks, mosquitoes, sandflies, and midges. It has 100 different types, or subtypes rather, and can cause clinical and subclinical infection in infected humans. So the clinical feature is that the symptoms can be quite nonspecific and rather generalized. It usually, though, has quite a short incubation period, up to 10 days. It can present with acute fever, hemorrhagic fever, polyarthritis, rash, and central nervous system involvement, such as encephalitis, aseptic meningitis, coma, and death. The diagnosis is usually made based on serology. PCR tests are more accurate for a specification, but they're not readily available. The management is usually symptomatic. However, it's important to provide standard barrier protections to help with reduction of the spread. Encephalitis and hemorrhagic fevers are always notifiable disease to the local public health authorities. Let's do a question. A 28-year-old man returns from a trip to South America and presents with fever, headache, muscle pain, and a maculopapular rash. He reports multiple mosquito bites during his trip. His blood tests show thrombocytopenia and a mild increase in liver enzymes. Which of the following vectors is most likely responsible for transmitting the virus causing his symptoms? The options are A. Aedes mosquito, B. Culex mosquito, C. Anopheles mosquito, D. Ixodes tick, E. Sandfly. So some of you may be familiar with this, that this is quite a common infection in South America and Southeast Asia, which presents with quite non-specific symptoms such as the headache, muscle pain, and fever, as well as a transient rise in liver enzymes and thrombocytopenia. This is, of course, dengue, and therefore the correct answer is going to be option A, which is Aedes mosquito. Thanks for listening to this episode of Bite-Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.